Well, if you are experiencing the pain of peripheral neuropathy and longing for some relief, Dr. Dwayne Ackerman is back to bring us some good news about treatment. Always good to see you.
It's great to be back. It's a little chilly today, but it's great to be back.
It's nice in here, though, isn't it?
It's not bad.
You can stick around with us the rest of the day. Hang out with us, okay? Well, I know you need to get back and take care of your people. What do you want folks to know who have been dealing with this for so long, feeling hopeless about it? What do you tell them?
So that the big thing is there's hope.
Right.
There is solutions to this. The biggest complaints I get, or not complaints, concerns, is loss of mobility,
right,
loss of quality of life that people have, because this just robs you. When you can't move around, you can't sleep, you can't go for walks, you can't do all those things. It just robs your life, and life is short and precious, and you want every day to matter. And on the way over here today, I had an amazing phone call. My staff called me, and they said the patient just came in, just walked in, and that was a biggie, because in January, they came in a wheelchair.
Wow, that's huge.
Within about 2 months' time, they've gotten out of the wheelchair. They're now walking, and the daughter brought her mom in.
Yeah.
And the daughter's like, yeah, and mom's wanting to start driving again.
Mm-hmm. Well, yes,
and
of course.
The daughter's like, oh, I'm not quite ready for that. But she's bathing herself. She's getting dressed on her own. She's more independent. She got her life back. And they thought that life was over. I'm just going to be in the wheelchair and I can't do anything. So that's what this stuff is capable of doing. And we hope most of the patients aren't that severe when they come to see us, thank goodness. And we don't want anybody to ever get that bad. But even if it is that bad, if you're that person out there that can't function, can't get dressed, can't live on your own, your lifestyle has just been robbed from you, there is hope. You know, we have success stories every day now because we've been doing this.
That's a big one. That is a big one.
This was huge today. I was blown away when my staff called me and said, hey, guess what? We just walked in the door.
Wow. Well, how wonderful and how encouraging for everyone who's listening to say, okay, this is not the end of all things. Treatment can be possible. So explain a bit about the treatment itself and how we use it.
So all we do, the body has an amazing ability to heal itself. It just needs help sometimes. Just like if you cut yourself and they put stitches, or you break your arm, they put a bone. Sure. It just helps the body get in position to help itself. And that's all we do. Basically, this is a blood flow problem to the nerves. The nerves don't get the oxygen that they need, and they deteriorate and they stop working. So we use natural therapies to help the body improve blood flow, and the nerves regenerate and heal. And then they start working again. And when they start working again, that's when you get your balance back and the quality of life back.
And that's the key right there, is when you can begin to enjoy rather than suffer.
Oh,
which
absolutely.
We're talking about. This is 24/7 if you have neuropathy.
Oh, it is.
It's not like it comes and goes.
Yeah, it keeps you up at night. It's painful during the day. It's terrible. It just steals the lifeblood out of you. Right. And life is too short to have bad days.
You bet. Well, the good news is there's good news, and you call Dr. Dwayne Ackerman's office to get that first appointment and find out what treatment works for you. Thank you. It's always good to see you. We'll be back with more Lifestyles right after this. Stay with us.
This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.